All right, good morning. It is now February 16th, 2023. I'm Dr. Duke Majan, and we're starting our live stream from the operating room here at Duke Spine and Surgery Center, Viera. Our patient presents to us with pain in the anterior thigh, front of the thigh, right side, and horrible back pain. His back pain was treated with the Duke plasma rhizotomy. It took the back pain away. That was done by Dr. Patel last week. However, he had persistent anterior thigh pain. As we know, facet joint pain can refer to the anterior thigh. We were hoping by treating the facets, we would get rid of the back pain and the anterior thigh symptoms. And unfortunately, the anterior thigh symptoms are due to three pinched nerves. We offered the patient surgery to fix all three pinched nerves. However, he chose to do one, the worst one, and that's the L3-4. So we're going to do the Duke laser disc repair, which is basically transforaminal endoscopic surgery, and we're treating what's called a foraminal disc herniation, a herniation within the foramen. Lay still, okay? So our patient's awake, they're not intubated, there's no tube down the throat. He's getting twilight sedation. We're going to have to give him some numbing medicine. We've already numbed the skin up, and we're going to give him some more numbing medicine as we go in and head towards the spine. Now, the first thing we do in the surgery is we use a needle, basically, to head to the spine. All right, that looks good. That's a good entry point. So we'll give some more numbing medicine underneath. And what I'm numbing here, you got to lay still. What we're numbing here is the fascia shot. That's it right there? Yeah, good. And the soft tissues. Everybody has different pain levels or thresholds, we call them. Some people are more sensitive to pain, and what I mean by pain is what we call acute pain, than other people. And acute pain doesn't mean it's cute, like a teddy bear. It means it's acute as in immediate pain that's occurring now, as opposed to chronic pain that some people live with on a daily basis for years. Shot. My first job here, as you can see, is L3-4. Jordan, you want to show us L3-4 disc? That's the L3-4 disc right there, okay? And his herniation is in the foramen. You can actually see it on the x-ray. That's how good the x-ray machines are when you have a top-of-the-line x-ray. Show us the needle tip. Very good. And we're aiming right for that foramen, right for that herniation. Shot. Shot. All right. I'm getting there. Lay still. Shot.
We're going to be asking you some questions, my friend.
Yeah.
Nice and still.
Lay still.
Okay.
All right. So, yeah, that's the herniation. He's not happy about it. Where do you feel that?
Where are you feeling your pain? Where? Lower back and side.
All right. Give me an AP. So some of you may be wondering, why does the patient have to be awake? We need them awake for the beginning of the surgery to make sure that my needle is going through all the right areas to get to the herniation. And so far, it's looking good. All right. That's the AP view. You could see on his x-ray earlier that he has a degenerated disc at L5-S1. Jordan will show you that. It's a collapsed disc. And then he's got herniations at L2-3, L3-4, and L4-5. We're going to be fixing this one today. Where is that?
Don't move, my friend. Where are you feeling the pain? Tell us where.
Where do you feel the pain?
Hip.
Yeah, that's facet. Big herniation. I felt the herniation all the way out in the foramen. You're all right. All right, so one other thing that herniated disc can cause is back pain. So just so you all understand what's happening, this is his L3-4 disc. And there's a nerves, they come down in the spinal canal and then they leave and go down your leg. Some of the nerves go down the back of the leg, some of the nerves go down the front of the leg. The ones that go down the back, called the sciatic. The ones that go down the front are called the femoral. So he has a tear and a giant herniation right here that's pushing on that nerve, and that's what we're going to go after. But I want to see if he gets back pain as well. Are you comfortable?
You feeling better?
Huh?
He says it hurts. He says
Lower back? All right. How bad is that on a scale of 1 to 10? All right, so I just gave a little bit of dye. You saw that, just a tiny squeeze. He had 10 out of, is that where you get your back pain?
Yes.
Wow, okay. Just relax. We're going to put you to sleep now, okay? All right, Jordan, show them on the view, the lateral view, Henry. Show them the herniated disc. Here you go. The herniated disc. Yeah, right there. You see that? So that's an outline of part of the herniation right there. It shouldn't be there. That's a herniated disc. Give me a count from 1 to 100. I'm going to have the patient count out loud from 1 to 100. When he stops counting, he'll be asleep. Keep counting. If we can get the blood pressure down too, that would be great. I'm going to give a little more numbing medicine in the skin. We're just going to give that a minute to work while he's falling asleep with the medicine we're giving him. We use propofol sedation. Propofol is the best you can do. Keep counting. So he stopped counting, which means he's probably sleeping. We're making a 7mm incision. 7 millimeters is about 1/4 of an inch, roughly. That's how big the surgery incision is. I just came back from a meeting in Utah. You have to be invited. You have to be a spine surgeon, neurosurgeon, and it's for basically the top academic spine surgeons, meaning those that control the universities where spine surgeons are being taught. We had the head of spine surgery at UC San Francisco, for example, right now ranked #1 in the world for neurosurgery. We had the heads of spine surgery, the leaders in spine surgery from around the United States there. And it really surprised me to hear all of them are doing just all these open back surgeries. Big incisions still, peeling the muscle off the spine, damaging the muscles, causing scar tissue and bleeding, removing the bones in the back of the spine called a laminectomy, which destroys a part of your spine that you need, that's normal, that isn't even involved in this problem. And I was telling them about endoscopic surgery, which is the future of spine surgery. And to be honest with you, I don't think they were that interested. They're more interested in screws and rods because they're all basically making money, millions of dollars a year themselves, for promoting screws and rods to the spine surgeons that are being trained and coming out of training and going out into private practice. Each one of those spine surgeons will represent around, in their career, around $80 million to $100 million worth of business, each one. And they're training 2 to 3 a year. So think about those numbers. The companies that manufacture the metal, screws and rods, cages, fusions, artificial discs, they don't want the spine surgeons of tomorrow to not do metal. So getting their bosses, their leaders, the professors, to change their ways is almost impossible because they're making millions of dollars a year just promoting the use of metal. All right, I'm going to give some num-num as we go down, but this is the future of spine surgery. I'll tell you why. Because when you cut through all of the special interest groups involved in spine surgery, and you get to the most important stakeholder, we call them stakeholders, people that have a vested interest in this industry, the most important is the patient. And ultimately, when the patients find out this surgery is available, where you don't have to have open back surgery, where it can be done endoscopically, without metal, without fusion. When the patients learn about this, I can feel the herniation right here. Show me the lateral, like right there. I'm literally pushing on it. Yeah, there it is. You can see the herniation. It's huge. So what I'm going to do is I'm going to try to push this herniation back into his disc. Literally just shove it back in through the tear that's already there. Gently, okay? Getting it away from the nerve. And by doing this, I'm going to be able to take the herniation out safer from inside his disc. I can feel the tear. It's huge. Can we get a blood pressure?
It's checking right now. Just
Yeah.
give it
Yeah. All right, we are now inside his disc. We're through the tear in the annular wall. Show us where the annular wall is on the x-ray. There, to, start going in. No, that's too far. So start on the outside of the annulus, right on the outside of the disc, and now go inwards along, right there. Stop. That's it. That's how thick the annulus is. Show them. There to there. And again, there. Can you guys see this, Henry? To there. It's about 2 centimeters.
Yes, we see it.
2.5 centimeters. So I'm putting the tube into the innermost part of the annular tear. How's pressure? No, yeah, you got to get that down. Okay? Put a little pressure. All right, I'm going to wait for a minute. Let me know when you're ready, Dr. Berndes. Any questions from our audience so far?
Yes, we have a question from Diver X on Facebook.
All right, before I take Diver X's question, you guys always see the lateral view, right? You guys see the lateral x-ray view. But the lateral view doesn't give you the whole picture of what's happening here. I use the lateral view because I need it to navigate and to localize. But show us the AP view right now. I got the pressure. Okay. Tell me when you're going to take a shot. The AP view is the front back. And it's important because before you take this picture, I want to tell you guys, it's going to show that we're coming into the spine from the side. We call it transforaminal. It's very important. It's a technique that was developed by Dr. Parvis Camben at Pittsburgh. He was the first one to do transforaminal surgery and to treat these exact type of herniations called the foraminal disc herniation. Okay, I'm going to write it down in a minute. You guys can see it. There it is. So you see how we're coming from the side? Jordan, show us where the lamina is on that picture. The lamina is in the midline. Go to the middle. Yeah, see where the spinous processes are? The lamina is between them. Yeah, right there. And then it goes to the side, and it ends right at the facet joint. Go, keep going, right there. So that's, go side to side. That's a lamina, guys, and it's in the back of the spine. All the other spine surgeons have to drill that lamina away. They remove it, okay? But we're coming from a hole that's already there, so we're not doing any damage. Let me know when you're ready, Dr. Berndes. I'll take the question from
Diver X.
Diver X. By the way, this is a foraminal. There's 2 ways to write foraminal disc herniation. That's what we're treating today. And Dr. Parvis Camben, sorry to use my patient as a drawing board, but that way we can memorialize it for his surgery. Dr. Parvis Camben was the first to do a transforaminal endoscopic approach. And he taught my professors this technique. The beauty is it requires no metal, no fusions, no metal that we leave in, no fusion, no artificial disc. It's literally all natural and very, very safe. It doesn't create any problems, like small incision, no muscle damage. You saw the bleeding is minimal. All right, good. So now we're at the beginning of the herniation, where it starts at the nucleus pulposus, at the innermost part of the annulus. All right, sorry, go ahead, Henry.
The question from Diver X, they ask, are you doing non-invasive metal implants as well? And how about the degenerative disc treatment?
Yeah, so first of all, this surgery you're watching today works for herniated disc, degenerative disc, ruptured disc, bulging disc, protruded disc, extruded disc, all of the disc problems this procedure fixes. Okay? So, as far as minimally invasive metal procedures, do I do them? Yes, I do. I know how to do them. I do fusions. I've done 1,000 fusions on the back, 1,000 in the neck. That's more than most spine surgeons do in their entire career. I used to do them all the time. But you don't need to. You don't need to put metal in people anymore. That's the whole point of these broadcasts, is to teach that point. All right, we are now inside the disc. You can see the herniation. Remember, I shoved a lot of this herniation. There's a piece of herniation right there. I shoved it into the disc. There it is. Let's show the audience. Our very first, that's like going fishing, and you cast out your line, and right away you catch a fish. See that? That's not the whole herniation, but that is a big piece. There's probably, I would say, at least 10 pieces, maybe 8 pieces like that. Can you guys see the size?
Yes, we do.
That's a full centimeter long and 3/4 of a centimeter wide. Here you go, Luis. All right, so already we've taken our first piece of herniation out. Great question, Diver X. By the way, if you have or know somebody with back pain, herniated disc, bulging disc, protruding disc, here's more herniation. Just send them to us. Oh, that's another big one. Look at this. Let's get the light on again. I just want to show you all once again. Already we've caught 2 fish. Again, this one's a centimeter long. You guys see this?
Yes, we do.
Is the tube in the way, or you can see it clearly?
No, we can see it.
All
It's all
right.
good.
It's identical in the size. Now, by the way, look at this here. I want you guys to see this. Bring the other piece. This is very important. Everybody thinks a herniated disc is a herniated disc. It's not. It's about 20 pieces like this. Not this big, obviously, smaller. But you can see each of these is individual and separate. They happened at different times. Why did they happen? Because there is a tear in the wall. And Duke Spine Institute, we're the first in the world to describe this process. Okay? Sure, everyone knows about annular tears, but people don't understand the importance of them. Here's another one. So oh man, this is the big one, guys. Check this out. Oh yeah. Yeah, baby. Look at that. Wow, it's crying. Okay, everyone see this?
We see it.
Holy mackerel, that thing is 2 centimeters. It's more than 2 centimeters. You guys see?
Yes, we do.
Here's its brothers and sisters. Okay, right here. You guys see? This is, so think about it this way. Imagine you go to the hospital and you're pregnant and you're ready to deliver. And instead of 1 baby coming out, you have 20 babies, okay? Everyone thinks you got 1, but you got 20, all right? That's what herniations are. Can you see this?
Yes, we can.
Okay. Now we're doing all this without a laminectomy. Every other doctor around will do a laminectomy, and it's a big mistake. Laminectomies do one thing. They ruin your spine, and you're going to end up needing fusion afterwards, okay? Who wants fusion? Raise your hand. Has anyone brainwashed you to believe you need a fusion? You don't. Okay? They're telling you that because that's all they know how to do, and that's all they want to know how to do. Surgeons that only do fusions and don't do this Duke laser disc repair, they have one thing on their mind, themselves. And if you're going to a doctor who's just thinking about themselves instead of thinking about your well-being, you're making a mistake. That doctor is not going to help you. They're going to help them. Okay? Unfortunately, it's a systemic problem, and it's not just in the United States, it's all over the world. Doctors just wanting to do fusions. Now, I used to be one of those doctors because I didn't know any better. I didn't know about endoscopic surgery. And then I learned about it, and once I learned about it, I immediately saw that it was better for patients. Not better for me, because you don't make as much money as a surgeon doing it, but it's definitely better for the patients. And ever since then, I've been promoting it. For 16 years, we've been doing this surgery. And now pretty much it's all I do. And people need to know they have a choice, a better choice, not just any choice, a much better choice. And that is endoscopic spine surgery. And not just any endoscopic spine surgery, literally the Duke laser disc repair. That's what we're doing today. It's its own unique procedure. It has what's called an annular debridement, which is what I'm doing right now. It's not a discectomy. We're not taking your disc out. We're taking your herniation out. So it's really technically a herniectomy plus an annular debridement. All right. So far, everything's going well. Patient is snoozing. He's getting the best sleep of his life. So I'll tell you the story. This patient was referred to us by the hospital. He came to the hospital in severe pain in his back and his thigh, his right thigh. They didn't know what to do with him. They gave him narcotics, painkillers, nothing worked. So then they called Duke Spine, okay? After they had their way with him and they failed, they called our company. We brought him in. Initially, we did a facet treatment, which worked very well for his back pain. But as you could see today, when we tested his disc at L3-4, this one, he actually has 10 out of 10 back pain from this disc, which means that we didn't get all of his back pain when we did the facets because he had his disc also causing back pain. You see, back pain comes from disc and it comes from facet. It's about 95% of back pain is disc or facet. And the disc is responsible for about 85% of back pain. So when people come in and they have back pain, chronic back pain that is, not acute, but chronic, chronic back pain, it's 85% of the time due to a herniated disc, like this. We confirmed that for him by the discogram. And then the other 15% is due to facet joints, which he had his facets already treated. We started with that because we were hoping that's all he needed. Facet treatments are less invasive and they're less expensive. So we like to treat the facets first if we think somebody has facet pain. And he did have facet pain on initial presentation, so we treated that first. And it worked, except he had a disc problem as well. And that's what we're fixing today. All right, any questions? This is all herniation here.
No,
We're using the laser to remove it.
no current questions, but we do have a comment from a Larry R. Jones on Facebook. And they said, I have had 12 back surgeries, a fusion spinal cord stimulator implanted
12 back surgeries.
that quit working 6 years ago.
Yeah.
So now I have a battery pack in my right butt cheek. Severe nerve damage from so many back surgeries.
I'm so sorry to hear this. This breaks my heart, honestly.
And pretty much at the end, he's, I wish I knew you before now.
Yes, sir.
I knew of you before now.
Yes, sir. Yes, sir. We are so sorry that we are trying to change that. That is why we're doing everything we do at Duke Spine. It's for people like you that should never go through that. Honestly, never, never, never go through that. I look at this war in Ukraine right now, and I look at the death, the damage, and destruction. War is so bad, people don't understand it, how horrible it is. No one should ever have to go through war like that. It's just totally unnecessary. It stems from one thing, greed. And unfortunately, this patient who's had all these back surgeries, it's from one thing. It's called greed. It's no different whether it's Vladimir Putin and Russia and the oligarchs trying to make money off Ukraine versus a spine surgeon doing, over 10 surgeries on a patient. Same reason, to make money. Okay? The sad thing is that these spine doctors doing all these procedures, they don't care about the patient. They just care about themselves and making the money. And it breaks my heart these days to see this happen. Now, I'll be honest with you, before I knew that we could cure back pain with surgery, I thought pain management was the right thing to do. Because I was brainwashed like everybody else coming out of these universities to basically just go back and forth between spine surgery and pain management, that was normal. That's what we do. That's the best we can do for people. But then Once I got out and started taking care of patients on my own without the direction of the professors at the universities, I learned that we could actually cure people's back pain and neck pain, cure it with one procedure, one surgery. And then I realized after many years that interventional pain management, like spinal cord stimulators, morphine pumps, epidurals, facet treatments, rhizotomies, RFA, that none of it actually gave patients any lasting relief. So then I started asking, well, why are people getting these procedures if they don't last, if it doesn't work? And the answer became very abundantly clear to me. Because the pain management doctors, even though they knew that I could cure those patients' pain, they wouldn't send the patients to me. And I realized, I scratched my head, why? Is it my name? Is it my looks? Is it my hair color? Is it my family? Why wouldn't they send their patients to me when I could cure them of pain from my surgeries? And it became obvious. The reason was money. They didn't want to stop making money on patients. And that's what we've got today. And it's getting worse every day. I see it getting worse on a daily basis. And patients are suffering as a result. People are suffering. They're living in horrible pain. They're getting all these procedures that don't work, and they're paying out of their pockets millions of dollars. The average patient today pays $250,000 when they have chronic back pain out of their pocket in their lifetime. 250 grand in copays, deductibles, coinsurance for the treatment of their back pain. Okay? Average. That's over 20, 30, 40 years that they have their pain. The suicide rate of people who are committing suicide because of chronic back pain that they believe they have to live with for the rest of their life is skyrocketing. It's skyrocketing. And I'm going to tell you something. Social media is making it worse. I'm not saying social media is bad because of that. I'm just saying it's making it worse. It's making it worse, okay? Because you have all these people now sharing their failures of treatment. They're sharing their failures. They're sharing the fact that they've had these surgeries. They've had these treatments, and they don't work, just like this person has written. And the other people who are hopeful and optimistic, they're seeing this. And they're saying, oh my God, it doesn't work? Well, what the hell is the point of living life like this? I can't. And then they off themselves. So suicide is a byproduct of chronic pain that people feel hopeless about. And that's why we do this broadcast, is we want people to know we can cure your pain. No longer is there such a thing as fibromyalgia. Fibromyalgia is a lie. There is no such thing. I have been treating chronic back pain now for 20 years on my own here in Florida, and we see 100,000 patients. We have 0 patients with fibromyalgia. That's because we know the diagnosis, where the pain's coming from, and it's not fibromyalgia. But other doctors are totally incompetent at making a diagnosis as to the cause of the back pain because they don't know how. And instead of sending the patient to us, they send it to the pain management. And the pain management doctors write pills and do shots, and they tell the patient they have fibromyalgia, because otherwise the patients would say, well, why aren't your treatments working? And the answer is, you have fibromyalgia. That's their defense, but it's a lie. You see, there is no such thing as fibromyalgia. I'm sorry, but that is the God's honest truth. Everybody with fibromyalgia has either facet pain or disc pain, or that's really it, facet or disc. I mean, the other causes are fracture, tumor, or infection. And those are pretty obvious on MRIs. So what I'm getting at, folks, is there's a big problem in the spine world, and that's not going to get better overnight. But the only way it's ever going to get better is if you, the people, stand up and start demanding from your doctors that they make the right diagnosis and that they send you for the right treatment to get rid of your pain. Eliminate it. Okay? So thank you for your comments. I'm very sorry to hear about your years of suffering, and I hope to God that you find your way here to Duke Spine and maybe we can help ease your suffering. This is all scar tissue right here from his herniation, chronic inflammation. Most of the herniation is gone. There's still some left here. You can see this is lateral. This is what I was concerned about when I saw his MRI. A lot of this is, not towards the middle, but off to the back, off to the side, really. I call it the back, but it's It's off to the side. Okay. We're almost done. What have you noticed about watching this surgery? How much of this surgery was done with the laser? That's the laser, by the way, at 12 o'clock. You see that thing? That's the laser. How much of the surgery is done by the laser? Anybody want to venture a guess? About 100, almost 100%. About 99% is using the laser. So you can't do the surgery without the laser. It's impossible. Other surgeons do. That's why their results are not so good. They don't get rid of back pain, that's for sure. All right. So there's some blood vessels.
We have 5 minutes?
Yeah, 5 minutes. I want to make sure, okay? Let me just try to, yeah, we definitely have at least 5 minutes. I don't know if I can be done in 5, but we'll see. Yeah, yeah. Yeah, there's some fat right there. I'm going to try to go over here and see if I can grab out any more herniation. There's a little piece there. Now, I'm going to tell you, if you're a surgeon, spine surgeon, and you are interested in this technology, I like to talk about the relationship between the laser and the grabber, aka pituitary rongeur. There is a relationship, and that is that the laser frees up, or basically loosens up the herniation, and the grabber takes it out. All right.
We have a couple more questions.
Yeah, we'll take your question.
This next one comes from Larry Jones once more on Facebook. And he asked, so disc degeneration is where the disc wall ruptures?
Yes. Is that the question?
I believe so, yes.
Yeah, so Larry, nobody else understands disc degeneration. They're able to see the pictures of it. They're able to see structurally what's happening. So what we all know about disc degeneration is that there's a collapse of the disc, that the disc turns dark on the MRI because it loses water content. So we call it dehydration or desiccation. Okay? So there's desiccation of the nucleus. There's annular tears. There's collapsing of the disc height, loss of height. There's end plate changes, okay, of the vertebral body. So all of these degenerative changes, because they happen over time through a process they call degeneration, which is basically a destruction of the normal architecture and shape and physiology of the disc. All of that, people say we don't know what causes it, okay? But at Duke Spine Institute, we discovered the cause, and it's inflammation. Inflammation from the herniated disc. You cannot have a degenerated disc without a herniation. It's impossible. The herniation is the beginning of all degenerated discs. A herniation, okay? That's what we have found. There's a bone spur, by the way. I've already blasted it. Let's see, almost done. Another 2 minutes maybe. Just trying to get the last of this herniation medially. But degenerative disc disease is caused by a herniated disc, which is caused by an annular tear. So let me back up. Degenerative disc disease is due to inflammation in the disc, chronic inflammation over time, many years, which is caused by the herniation, which is caused by the annular tear. So all of this begins with an annular tear. And again, this is what we've discovered at Duke Spine Institute to be the truth. However, you're not going to find it out there on the internet or in textbooks because it's that new. Just about done. I want to do this last part here. Great questions. Keep going on the questions. Happy to answer them.
No problem. This one.
Before you do, let's do a quick video that shows people how do herniated disc actually cause back pain. And then we'll take the questions afterwards. Man, snoozing, huh?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Maybe some there. All right, welcome back. We're just literally wrapping up this herniation, and this is all the lateral stuff. We've pushed a lot of it towards the midline, but this is all, we want to get as much lateral stuff as we can, because that's where the nerve root was getting affected. And just about done. 1 minute. You saw all the big pieces of herniation we took out. That's the laser, by the way.
We have a question.
All right, we'll take the question. Grab her.
This comes from Dan on Facebook, and they asked, do you suspect that the affected vertebrae will fuse themselves over time, and is that likelihood dependent on how much of the disc gets removed?
Hey, Dan. Yeah, that's the lateral herniation right there. So, Dan, I think a lot of people like you get very confused about what we're doing here. We're not removing the disc. This is going to be a big one. Hold the tube. Yep, nice job. This is a big one. This is the Moab. There it is. That's the lateral herniation. That's the lateral herniation. That's the big one. Guys, that's why this is the number one reason people have failed back surgery for foraminal herniations. It is a foraminal disc herniation. That is the Moab. You guys know what Moab is? So really, it's a term the military developed, mother of all bombs, but we call it the mother of all births.
So that's the Moab, mother of all discs.
Feel the herniation with your fingers. Yeah, there it is. Let's show the audience what we got today. Let's put it all right here. This is it. We're done now. I'll go and just take one more look. Look at all this stuff, guys and gals, boys and girls. Don't try this at home. Okay? Can you guys see this? Let's show everybody the endoscope. Can you see this, Henry?
Yes, we can.
Look at how the endoscope uses the endoscopic grabber. Guys, this is the future of spine surgery right here at Duke Spine. It's sad that my brethren, all the other spine surgeons in the United States, are so obsessed with putting metal in for their own benefit that they haven't moved to the next level of treatment, which is endoscopic. We saw this happen with hips, with knees. It started out many years ago by fusing knees and hips. Then it went to artificial knees and hips, and now it's endoscopic repair. That's happening in the spine. Unfortunately, 99% of spine surgeons in the world don't know how to do this surgery. But there's the big foraminal herniation that was crushing his nerve and causing all that pain. All right, I'm going to go in and look one more time, and I'll answer your questions as soon as I get to the conference room. Okay? But we're going to wrap this up.
As soon as you got that out, his blood pressure finally dropped.
Yeah, look at that. And you can see the venous bleeding. So we got all the pressure off the veins. Here you go. We're done. All right, we're done. There's nothing else there. I always tell people, you know, we don't remove 100% of the disc herniation because it's impossible to do. We can only get about 90% in a best case scenario. So even though we got all these herniations out, okay, I still think we still only got 90%, okay? And it's just not humanly possible to do better than that. You need about 50% of the average volume of the herniation and annular tear. You need about 50% fixed to get rid of symptoms. That's just a rule of thumb. Guys, I want to show you this. We're done. This patient is snoozing. Can you guys hear him?
Yes, we can.
He is just loving life. And the anesthesiologist, Dr. Berndes, mentioned to me that his blood pressure dropped after we got that last herniation out, right? In other words,
Running it the whole case even when he was in the room.
yeah,
It
and
was 180 over 90.
yeah, his blood pressure was up at 180 over 90 because of the pain he's having. And once we got that herniation, the big one off the nerve root, we've been watching his blood pressure coming down as we've taken pieces of herniation out. And when we got the Moab out, once we got that last piece out, his blood pressure literally dropped. How many points would you say?
Had a colon surge. He
Yeah.
dropped about, it was 140.
So
31 points.
31 points. It dropped 31 systolic points. Why is that important? It shows you how pain doesn't just affect your perception of pain and limit your activities in life, but it actually has a negative effect on your hemodynamic system. It alters your whole physiology, Dr. Berndes says. So get your backs fixed. Come to Duke Spine. Look at that, guys. Look at this thing. The whole surgery was done with that. Had he had this done elsewhere, he would be having a fusion by these doctors. Great job. All right, I'll come and answer your questions face to face. Good job, everyone. Thank you. Great work. Go ahead and show our audience, how does the Duke laser disc repair actually work, Henry?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
And I'm Dr. R. Duke Majan here at the Duke Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year,
Okay.
of the new year. Now, you had the Duke laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I'm a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually it got better, and I thought, well, that's fine. And I moved on, and then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work with the blow dryer, going like this with my hair, and all of a sudden, it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is the surgery going to
I'm
help you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church and my
So you
community.
want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith
I
and
am.
you found us.
Yes, I
and
did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought was I needed to do
good.
for me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to, sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
I'm Dr. Duke Majan, and literally just walked out of the operating room and sat in this chair and sitting next to Henry, who's doing an incredible job with our broadcasts. We've just completed a Duke laser disc repair on a patient who came in with, as I said earlier, back and right thigh pain. And the first thing we did, we recognized that he had what's called facet joint pain. I'm going to bring up a model so you can see what I'm talking about. Actually, I'm not going to use that one. I'm going to use this one, okay? So, the spine is made up of segments, or like a Lego set where you stack Legos on top of each other, except when you do that, the Legos don't really move. But in the spine, you have, the Legos are what are called the vertebrae, which are these bones, okay? And the bones are stacked on top of each other, and between the front of the bones, this front part's called the vertebral bodies. You have a disc, which is a joint, okay? A disc. And then in the back, you have a facet joint, all right? So there's 2 types of joints. In the front, the disc. In the back, the facet. And in the back, you have 2 facet joints for every disc. So let's pretend this is the L3 bone, and this is the L4 bone. So L3, L4, and this is the L3-4 disc, okay? And you have also a left L3-4 facet joint and a right L3-4 facet joint. And if you look over here, this is what we dealt with today. You see that right there? That's a herniation. That's a herniation. And more importantly, it's a herniated disc. It's where there's a tear in the disc and the jelly in the center squeezes out, okay? More importantly, it's a foraminal herniation, meaning it's a herniation that occurs in the neuroforamen, the area where the hole is where the nerve comes out. So I went in like this, and as we worked from the base of the herniation, the base of the tear out, I cleaned the tear with the laser until I got to the last part at the end, the part that's in the foramen, and that was the big piece that we pulled out. That was underneath the nerve root, pushing on the nerve root. Okay? So this patient first came, and he definitely had facet pain. We treated that with the Duke plasma rhizotomy. It got rid of his facet pain, but he still had anterior thigh pain. And we recognized on the MRI that he had a foraminal disc herniation. And so we told him, you need to have surgery done to get rid of that. And that's what we just did. And it went very well. I think he's going to do very well. All right, we have questions from the audience, and I'm going to ask Henry to share those questions.
This is a series of comments. Yeah, that's my keys, I know. It's bad. But yes, you got a layer of comments from Larry Jones, and he's was just during the conversation. He said, "Pain management, OMG. I was put on fentanyl suckers for years. Overdose, went through detox, Dr. Dolis Pain Center in Birmingham, Alabama, and now only use tramadol for my pain management." And he went on to say, like, pain management doctors are just legalized drug pushers.
Yeah, and who is that, Larry?
Larry. Yeah.
So Larry, thank you for your comments and participation. All of you, thank you for being here. Look, for those of you who have watched my broadcasts over the years, you understand I have a soft spot for people in pain, okay? And that's what drove me as a neurosurgeon to do what I do today. I cure back pain and neck pain in patients. That's what we do at Duke Spine. How did I get here? Well, most neurosurgeons and most spine surgeons, their focus is not eliminating back and neck pain. Their focus is spine surgery is basically what they call stabilizing the spine, which is basically putting in screws and rods and cages, okay? That's the end goal for them, not for me. It used to be for me because it works if you do it right. It takes away the pain. However, what I learned is you didn't have to do this to get people out of pain. You could actually do what we just did, the Duke laser disc repair. Much less invasive, faster recovery, better results, and no complications with metal like loose screws, loose cage, migrated cage, moving cage. Cages, they move when you put them in. They can pop out, okay? So there's all these complications that happen all the time with metal and fusions. For example, they just did a study, and this is what all the neurosurgeons are now being taught, is that if you do an ACDF, you put a plate in the front for a herniated disc in the neck, 48% complication rate. If you do a PCDF, where you go in the back, the complication rate is 25%, half, basically half. So 50% for ACDF, you go in the back of the neck, 25%. But they're still fusing, okay? 25% complication rate is horrible. The Duke laser disc repair has a 0% complication rate. We've had 0 surgery complications from my surgery in 16 years, okay? We've had 1 anesthesia complication in 16 years. That's in 1,600 patients. So the complication rate is less than 1 in 1,000. You can't even have a number that small in spine surgery. Nobody else can even talk about a complication rate that low because the open surgeries have many, many complications, okay? So your comment about fentanyl and pain management doctors, it's the essence of why we do what we do. Because the alternative, if you take away what Duke Spine does endoscopically, you're looking at interventional pain management procedures, epidurals, facet blocks, rhizotomy, RFA, spinal cord stimulators, pain pumps, interspinous devices, all those surgeries they do, plus all the surgeries that the real spine surgeons do, like orthopedic and neurosurgeons, all of that stuff results in patients still being in pain and needing more treatment. And the spine surgeons send the patients in pain after their surgery over to the pain management docs. The pain management docs do a bunch of shots and they lead the patient like a donkey with a carrot. Hey, we can help you. And then after 2 years of pain management and sucking out $30,000 to $50,000, they send the patients back to the spine surgeons. You need another spine surgery. Then the spine surgeons do another spine surgery and they extend the fusion. They go further up or further down. And then when the patient's still having pain, they send them back to the pain management. And then the pain management docs do the pain management procedures again. And they're doing spinal cord stimulators and morphine pumps. And the patient's still in pain. Then they go back. It's a ping pong, and it's costing the average patient around $250,000 US a year. It's a scam. The worst thing about it is most of the doctors don't even realize they're scamming patients, but they are. I didn't realize it when I was doing all the fusions. Why? Because that's all I had, and it worked. Then I started doing endoscopic, and I realized there was a much better way. So, your comment about fentanyl. Here's my response. In the 80s, we as doctors, as a medical community, did not have a cure for back and neck pain. And patients came to the doctors in the 80s and 90s, and they had pain, horrible pain, just like they do today. And the doctors gave them narcotics. Narcotics are how we treat pain in the hospitals when people are in pain. But these community doctors were then able to give an oral form of the narcotic that the hospitals give IV or IM, intramuscular, which lasts longer, but that's for people in acute pain in the hospital. So these drug companies developed oxycodone, OxyContin, and basically promoted it to doctors and patients in the community in the 80s. Okay? I personally don't think that's the reason why we have this opioid crisis. You're led to believe the opioid crisis is a result of bad pharmaceutical companies and bad doctors, but that's not the truth. The truth is that we didn't have the technology to cure those people at that time, and that was the best treatment available. Okay? But now, today, we have the technology to cure back and neck pain. And what's keeping it from happening is the insurance companies. Insurance companies don't want to pay for your medical care. So what they've done is they've attacked the opioids that doctors prescribe for people in pain and have waged a war against the opioids so that the doctors look bad, the hospitals look bad, the pharmacies look bad, the manufacturers look bad, and they've got the government to go along with them because they control our government. In the meantime, the real culprit is the insurance companies. Why? Because they're disapproving, disallowing, not paying for, not covering treatments like the Duke laser disc repair or fusions now, because they're denying fusions, for back and neck pain. They're the ones driving people to alternative treatments like drugs. Now they've cut off the opioids. The insurance industry was spending $3.5 billion a year paying for people's opioids. By making the opioids illegal for pain, they have saved themselves $3.5 billion at profit. That's why when you look at their profits, they're going up. United Healthcare profit is over $20 billion a year now. Blue Cross Blue Shield, Cigna, Aetna, United, all of them, profits are ramping up. Why? Because they're paying for less of your care. More importantly, they've legalized marijuana now in all these states, so they have essentially taken $3.5 billion they're spending every year for your pain and transferred that cost to you because they don't pay for marijuana products because it's still illegal federally. Why do you think it's still illegal federally? Because the insurance companies want it to be illegal federally because that's their excuse for not paying for it. You guys are fucking sheep, and it drives me crazy that you guys, you, the public, the people watching me, everybody, you're like, Your minds are being controlled. Don't let it happen. Get smarter. Understand what's happening in the world around you. Yes, I'm a radical here. I'm giving you radical ideas, but this is the truth, the God's honest truth. If you follow the money, you'll understand the insurance companies who control the money and profit from denying you opioids for your back pain. They deny you surgery to cure you. They deny paying for your marijuana now that's legal in every state for pain. Okay? They're denying all those things and they are benefiting and profiting from it. It makes me sick. Okay? Why? Because I don't need $1 billion to be happy. Nobody needs $1 billion to be happy. They have $20 billion. Why do they need that? What we need is we need that money to go to the patients, to take care of people. There should be 0 people in the United States with back pain and neck pain. Every single one of them should be fixed. And honestly, there should be no pain management because it's unnecessary. They don't fix anything. And fusions, they should be gone because it's totally unnecessary, 90% of these fusions that are being done. Same thing with artificial discs, no better. Okay, so let's get back. I'm sorry about your 12 surgeries. I'm sorry about the fentanyl. I'm sorry our system is broken and it's only going to get worse because the insurance companies and the greedy doctors that do pain management and don't fix people, don't send them to the right doctors like Duke Spine to get fixed. They are controlling you. You guys have to wake up and you have to start doing what's best for you. Next question.
Next question comes from Dan, once more, on Facebook. And they ask, approximately what percentage of total disc were you removing with this patient?
Dan the man. Wake up, Dan. Pinch yourself. I've already said this before. We're not removing any disc. 0 disc being removed. You're killing me, man. I'm going to have to cut you off unless you start paying attention. You see this? That's the disc. You see that? That's a herniation. That's what we take out, not the disc. We take no disc out. The Duke laser disc repair is not a discectomy like you're thinking where we take your whole disc out. It's only removing the piece of disc that's out of place, pushing on the nerve. Okay? So we're not removing any percentage of disc. We're taking the herniation out. That's it. The herniation is disc, so we call it a discectomy, but it's not really removing the whole disc. What's the percentage? It's about 3 to 5%. We've actually published that in one of our papers. If you go read it, you'll learn.
Next one comes from Joseph Chase, and he asked, how can I get Medicare to cover this procedure? And why don't you tell people that Medicare doesn't cover this when you are asking for a deposit?
Joseph Chaves, great question. Joseph's asking about insurance. Hopefully, I just talked about insurance so you can understand it better. So Joseph says, how do I get Medicare to cover this procedure? Good luck. We're right there with you. We would love for Medicare to cover the Duke laser disc repair, but Medicare does not cover artificial disc surgery in your neck. Medicare does not cover artificial disc surgery in your back. Medicare does not cover many of the new technologies. I don't know any new technology that Medicare actually covers. Why? Medicare doesn't cover stem cells. Why doesn't Medicare cover procedures? The answer is simple. The private insurance companies like Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, they control Medicare in 2 ways. Number 1, standard Medicare, and number 2, Medicare Advantage plans. Okay? You've all heard of Blue Cross Blue Shield Medicare Advantage, United Healthcare Medicare Advantage. Those are private insurance companies running Medicare through their own program, and they don't want to pay for this surgery. Why? Because it works. And they don't want to pay for surgery that works because more people will get it. Then they'll pay more claims. Then they're not going to make profits. You understand? They are profit-driven companies that you have chosen to be in charge of your health. Think about that. That's stupid. Why would you hire a wolf to guard your hen coop? You don't. But you did. So, number 2, Medicare. Medicare itself is administered by companies called Medicare Administering Companies, or MACs, M-A-C. If you look at the map of the Medicare MACs in the United States, you're going to see the United States is carved up into territories, right? The Southeast, for example, that's Florida, the Puerto Rico, I think the Virgin Islands, and maybe Georgia. There's a company called First Coast Services. If you have Medicare and you have First Coast Services, that First Coast Services decides what to cover. First Coast Services is Blue Cross Blue Shield. It's a subsidiary of Blue Cross Blue Shield. They hide themselves as First Coast Services because as they're denying paying for your treatment, they don't want you to see that it's Blue Cross Blue Shield denying it. They want you to see it's some company called First Coast Services. You think it's Medicare. It's not. It's Blue Cross Blue Shield. Why would they deny? They deny for one reason. Every dollar they save Medicare, they get a percentage of that as profit. So they are motivated financially to not pay for your care. Think about that. Why do you think artificial discs are not covered by Medicare? Why do you think stem cells are not covered by Medicare? Why do you think marijuana is not covered by Medicare? It's because they don't want to pay for you. How do you change this? You march. You contact your congressman. You contact your senator. You say, start paying for things that work. That's how you change it. Get up off your ass and make it happen. And don't blame the doctors because we're the ones coming up with the cures that are not covered by your insurance. That's the stupidest thing I've ever heard. Think about that. Why would you blame the person who comes up with a cure when your insurance won't pay for the cure? Boy, do I really have to explain this to you.
And next one comes from Feliciano Shields on YouTube. And they said, I absolutely appreciate your honesty and how you help people. These doctors are not trustful. I have a question about lumbar facet degeneration, and I want to know what can the Duke laser disc repair do to fix it. I was told from my MRI that I have a small disc bulge at L5-S1 and a mild foraminal stenosis.
All right.
And moderate degeneration. And
What's
all
her
we want
name?
to do is fuse. Feliciano.
Feliciano on YouTube?
Yes.
On YouTube. Thank you for writing in. Yeah, so here's what you need to do, okay? Simply put, you need a diagnosis. That's the simplest way for me to say this. MRIs don't give you a diagnosis. They give you findings, all right? Structural findings. They never tell you where your pain comes from. There is no test in the world by itself that will tell you where your pain is coming from. You need me, an expert, okay? And what I do is I examine you with a Zoom call. I can see where your pain is. I have you touch, I use your hands to do a physical exam. I look at your MRI. And I take that information from the MRI, your facet arthropathy, your bulging disc, and I look at your exam and I listen to your history about the pain, the quality of the pain, the location of the pain, the distribution of the pain, the radiation of the pain. I take all those historical pieces, I take your physical exam, which I do over Zoom, and I take your MRI, and I use all three of those to come up with the diagnosis as to what's causing your problem. Once I have your diagnosis, the treatment is easy. I mean, we have the treatments for every diagnosis. I just need to know what yours is. And I cannot do that based on, I have a bulging disc, I have facet arthropathy. I actually have to see you. I actually have to learn about your specific history. I don't do that just over Facebook or YouTube, okay? We have a way of doing it. It's called the MRI review. And I'm gonna have Henry do that right now. It's a free MRI review. If you go to the Duke Spine Institute website, dukespine.com, we have a free MRI review. You send us your MRI images and report, two things, images, report, and then you fill out the questionnaire. Sam will get that. Once we get your MRI images, we set you up for what's called a telemedicine visit. The telemedicine is a 10-minute visit by Zoom, and I literally will meet you personally and figure out where your pain's coming from. Once I know where your problem's coming from, the rest is easy. If it's the facet joints, okay, if it's your facet arthritis causing your pain, I'll be able to tell you that over the internet. If it's your disc bulge causing your pain, I'll be able to tell you that. Most people have two discs that are causing their pain, or two discs, maybe even in two facets, okay? I can tell you that, but I cannot tell you that based on the description from an MRI report. Nobody can. By the way, nobody can. So the bare minimum of what's necessary is a physical exam, a history, and at least an MRI scan. If I have those three things, I could be accurate with my diagnosis as to what's causing your pain about 98% of the time. 98% of the time, okay? And then the treatment would be either the Duke laser disc repair for the disc, if it's disc pain, or Duke plasma rhizotomy for the facet pain, which is the facet arthritis. Okay? Next.
Next comes from Leslie Vaz on Facebook, and Leslie said, I have to have surgery at C5, 6, and 7 for core flattening and herniated disc. They told me they need to do decompression and add a spacer infusion.
Hi Leslie, welcome to our broadcast. I'm Dr. Duke Majan. Thank you for writing in. What you're telling me is you have two herniated discs in your neck. It's pushing on your spinal cord. You are correct. You need surgery. However, you do not need a fusion. You do not need an artificial disc. Those surgeries have a 50% and 25% complication rate respectively. That means 1 out of every 2 people is going to have a complication. Think about that. You're going to go in and you're going to toss a coin, a quarter, and if it's heads, you're having a complication. If it's tails, you don't. Is that really what you want for yourself? Because you know what a complication is? It means they damage your esophagus, and then you may need a feeding tube, you may not be able to swallow again. They damage your spinal cord, they damage your nerve, they get a spinal fluid leak, they get an infection, they get some loose screws, they have to come in and do that over again. I mean, some of those complications have no way to fix them. Others can be fixed, but they require more surgery or treatment. Duke laser disc repair, the surgery you just watched, we do it on the neck. I've done about 600 of them in the last 16 years. We've had zero, literally zero complications. Why would you not want a safer surgery for yourself? We don't put metal. This is what your spine's going to look like after your fusion. 2 discs, 1 big plate, and 2 spacers, okay? And they're going to show you these sexy new discs and plates, okay? They're garbage. They don't work. They don't fuse properly. We've seen so many complications in patients with them. So leave, come to Duke Spine, do your free MRI review if you want. I'll tell you exactly what needs to be done, and we'll do it through a 4mm incision, that big. No metal, no fusion. Safe, outpatient. Literally 1 hour surgery, 1 hour recovery. We have hundreds of those surgeries online. You can watch them. It just kills me to hear people say they're going for fusions and metal.
And next we have from Liz Lindsay on Facebook, just a comment saying, I'm very thankful you are trying to educate everyone on these issues. I'm so thankful. Yeah, you're the best. Next one comes from...
Thank you, Liz. I'm glad you're here watching today. You're always in my heart and my prayers.
Next one comes from Feliciano, and they said, it's so frustrating not being able to get help, or the help not being able to afford it. People work hard, we have the best insurance, and it doesn't matter. Sadly, people are going out of the country looking for cheaper ways to get care. We're not expecting anything for free. They are getting plenty of compensation at our expense. Again, I appreciate your work.
Yeah, Feliciano, I hear you, and it resonates with me personally because, you know, I wasn't always a neurosurgeon. I was very poor at one point, and I had a cavity. I couldn't even afford to pay for the cavity to be treated because I didn't have the money. And um, the reality is that, you know, doing spine surgery is extremely expensive, and it's not my expense. It's not me. I'll do it for free. I don't care. The cost is all the employees, all the equipment, our electric bill just in this little building. We're a small company, by the way. Most of you don't know this, but we work out of a 20,000 square foot building. All right, that's small, and we have 70 employees. Our electric bill is $12,000 a month, just the electric bill. That's like, what is that, a year? $150,000 a year just for electricity. Okay, there's nobody giving us a break. When I want to put a monitor in the operating room so I can actually see what I'm doing, it's $10,000 for a TV screen, 72-inch. You go to Sam's Club or Costco, you can buy that television for $300. But no, not for medical. You have to pay $10,000. And I'm buying 2 new fluoro machines right now. My quote is $300,000. $300,000 for an X-ray machine, 2 of them. It's crazy. That machine couldn't possibly cost more than maybe $20,000 to make, and yet I'm paying $300,000 for 2 of them. That's the problem. It's the costs are out of control for the doctors and the facility, the equipment, the medications, everything we have to pay for. I'm not trying to do a pity party here, but we cannot survive without payments, and that money doesn't go to me, okay? It goes to pay the bills.
Last but not least, we have Dan Nates. I'm not going to say everything because it is a little too long, but the highlights of it saying is that that his wife had 2 fusions and 2 stenoses, and they thought that she might not walk again. I don't know if it was you or another doctor that was able to take her in. The insurance would not cover the laser surgery or many of the surgery places. The blame falls mainly with government, the regulation diversion of funds to all the wrong places and causes. And then to conclude it is like a little explicit. When you bitch about doctors, drug companies, and anything in the private sector, look to the governments for the source of the problems. P.S. When you bitch, get your goddamn facts straight.
Yeah. All right. So one of our viewers wrote an essay, which I'll respond to. Listen, folks, social media is wonderful. It's wonderful for us at Duke Spine because it allows us to share what we're doing to the world. It also allows me to share my knowledge and experience. Okay. Many of you don't know anything about me except you see this surgeon, neurosurgeon who's doing surgeries and talking. But you've got to understand something. Neurosurgeons, first of all, as a group, we're all selected the same way, and that is the top of the class in medical school. And you don't get to be the top of the class in medical school by being a slouch or being, think about it this way. The people that go to medical school go to university first. The people that go to university are the ones who did very well in high school. So take the top of the class in high school, top 10, 20%, they go to the universities. Then you take the top of the top universities, they go to medical school. Then you take the top of medical school, they go to surgery. And then you take the top of surgeons, they go to neurosurgery. So try to understand something. We are not the same, you and I, at all. And from a intellectual standpoint, we're not. I'm sorry, people always want to think they know what I know. I have arguments on Facebook all the time with people who have no education and they're telling me about spine. They just have a lack of appreciation of who we are. So that's number one. You got to understand, neurosurgeons know a lot. We're trained for 7 years after medical school. It's the longest, hardest, most advanced training there is in medicine. Okay? So my opinions actually are based in facts and experience in this field. So I'm going to tell you what's destroying healthcare. It is not the government. The government is passive. It's allowing it to happen. Okay? It is the private insurance companies like United Healthcare, Blue Cross Blue Shield, Cigna, Humana, and others. Okay? There's a lot of private insurance companies, but those are the big ones. They're destroying healthcare because they actually control our government. And if you don't understand that, then you really don't know what's happening. Okay? I'm going to tell you, it's not just healthcare that controls our government. The military industrial complex, go Google it, military industrial complex. These are corporations like Halliburton that supply military supplies, including weapons, including supplies to our troops. Those companies use our government as a bank just to make money, a printing press for themselves. They control the government. They feed our government supplies that we don't even need. They encourage us to go to war so that they can make billions and trillions, actually trillions of dollars. That's what we learned from the Gulf War. Halliburton made $2 or $3 trillion off of that war. One company, by the way, and there's others. So you've got the military industrial complex, you have the health insurance companies, all right? And then you had NASA. Let's just take NASA as well, because we're close to NASA. NASA has all these contractors that the government hires to provide things for our space program, okay? They were ripping the government off so bad that Obama shut down the damn NASA and the space program. Many of you don't know that. We live here. We know why it got shut down. Okay? When the government is paying $1,000 for a cheeseburger for its worker because the contractor is selling it for $1,000 and it's got corrupt politicians signing off on that, that's the problem. Yes, the government is allowing it to happen, but it's greedy corporations that are basically trying to bolster their profits at the expense of the taxpayer. That is what we're dealing with. It's corruption. Good old-fashioned corruption, folks. That's what's destroying healthcare, that's what destroyed NASA, and that's what's also destroying our military, okay? Which is why, I hate to say it, the Chinese are obviously catching up. It's destroying our economy, banks. So, yes, our government failed, and it's allowing these corporations to literally, like it's allowing a pack of lions into the sheep being the Americans and our taxpayers, and the lions being the corporations. They're just coming in and eating whatever they want whenever they want. All right, there's no regulation. There needs to be regulation, but that's a broken system I can't fix. I can try to fix healthcare, and I'm just one person. I have my audience, you guys are a small number. We really need a big microphone. Go out there and find Elon Musk. Elon Musk is having back pain. He's probably going to go out and get another surgery by some idiot who's going to do a laminectomy or some other procedure like an artificial disc, and they are going to fuck him up. All right? Don't let it happen. You guys go out and find somebody influential and powerful. Let's get the word out. Let's spread it. That's the only way the insurance companies and the government are going to start covering these procedures, is when the people demand it. Okay? The people have to demand it.
And that is it for questions.
That's it. I hope you enjoyed the broadcast. It's been entertaining in the least. And we'll be back next week on Tuesday with more surgeries. I was supposed to be on vacation this week, but I'm here working. My wife is not happy with me, but there's a lot of work that needs to be done, as you can see. Have a nice day. I'm Dr. Duke Major, and we're signing off from Duke.